Hello, SD Besties, Glow Getters. My name is Kaylin Jutris, and I am a licensed esthetician, continuing education provider, product developer, and the founder of Herbal Skin Solutions. Today, I am going to be talking to you a bit about understanding microneedling. So we are going to be covering depth, what is microneedling specifically, and what the difference is between rollers and mechanical devices like our CIT pen. So let's start with terminology. Now, we refer to microneedling as CIT, Collagen Induction Therapy. And that was because I had experienced some of my clients getting a little bit nervous when I called the treatment microneedling. Needling typically has a negative connotation. Needles can be a little scary. Ours, however, are finely tipped microscopic little needles. So with numbing cream, it is a very comfortable, painless service. Now, other names for microneedling are also microchanneling. Now, some of the aesthetic events that I've attended and trade shows, I have seen other manufacturers and device companies referring to microchanneling as this new hot service. Reality check, this is nothing new. Microchanneling simply is microneedling. It's just another term. You may also hear microneedling referred to as percutaneous collagen induction, PCI. Some call it the vampire facial or the vampire facelift. And when you are performing microneedling, there is depth to keep in mind. Now, with your depth, you can work all the way up from 0.25, the bare minimum. Let's see if my camera will focus in. 0.25, all the way up to 2.5 millimeters. Now, anywhere from the bare minimum, 0.25, up to 0.3. Here we go, 0.3 is considered cosmetic depth. And anything from 0.5 up to 2.5 is considered medical depth. Now, anything over 2.5, in my opinion, is the scope of a plastic surgeon because you're dancing on that fine line of being in the muscle. And I know there's a lot of confusion out there on which device is superior to the other, a mechanical device like the CIT pen or a dermal roller. Now, dermal rollers are much less expensive. However, if you're using them properly, they're not as cost effective as using an individual cartridge for each treatment. So we use these individual cartridges for each and every CIT pen treatment. These are never to be saved or reused on a client. You simply use one in a treatment and discard in a sharps container when you're finished to prevent from cross-contamination. And speaking of cross-contamination, that is my issue with rollers. And again, if they were being used as one and done, that is totally fine. However, when you use a roller, even if you are disinfecting it and you reuse it on the skin, you are cross-contaminating. So there's a pretty neat experiment I've done with my clients in the past. I would have them bring in their rollers and I would disinfect it in barbicide, which is a medical grade sterilizer disinfectant, and then I would put it in a UV light from there. So both of these forms of sterilization, most people don't have at home. So I was going above and beyond what somebody would typically do to clean their dermal roller. From there, I would put it under a skin scope, a woods or a mag lamp, whatever you like to call it, and turn off the lights. And from there, you can see all of these glowing white particles. Now, those glowing white particles that you see left in the roller, those are the skin proteins that never fully detach. So you see, if you were to roll that back over the skin, you would be adding all of those skin proteins. So always choose either a one and done roller or a sterile cartridge.